Welcome to Raaonline. I am Dr. Venkatekrishnan, Professor of Medicine. We have a discussion on a few multiple choice questions with regard to respiratory and CVS. The questions may be with UG level, but a few questions have specific concepts which may be useful for postgraduates also. We start with basics and must know for the UGs along with a few tough questions. What is with this question is, if you see, drug therapy for secondary prevention in MI, which is not true. The question will be, which is not true. The answers are aspirin, fibrates, statin, beta blocker. The answer is very easy. We can definitely answer this question, easiest question. The answer is fibrates. Primary prevention. If you see MI, primary prevention and secondary prevention. Primordial prevention is targeting the risk factors. Primary prevention is the patient has risk factors and you prevent occurrence of a CAD. Secondary prevention is the patient has got MI. You have to stabilize the patient on medications to prevent further or a new onset coronary artery disease. So, what are the drugs definitely for primary prevention? Aspirin, statin, beta blocker has to be used. Aspirin is antiplatelet, statin is, it's not only a dyslipidemic, it is specific to stabilize the atherosclerotic plaque. Statin has pleiotropic effects. It has effects on endothelial function and endothelial stabilization. That is what is very important with statins. Beta blocker, this is to target the heart rate, and if heart rate is controlled, myocardial oxygen demand and perfusion mismatch does not occur, so that the patient does not have angina. That is the advantage of beta blocker. What is fibrates? What is the role of fibrates? Fenofibrate. Clofibrate we don't use. Fenofibrate basically targets hypertriglyceridemia. Fibrates target, the problem is they have side effects in comparison to more side effects in comparison to statin. Fenofibrate, muscle injury, other non-specific symptoms can occur with fenofibrate, and they target only the TG. LDL effect is not much. The advantage of statin is it takes care of the LDL component. It has effects on triglyceride also. That is very important. When statins are given, triglyceride is not much decreasing, then you can consider fibrates. And the important thing is triglyceride, don't treat all triglyceride, high triglyceride. 300 to 500, more than 500. If 300 to 500 is the value, definitely you should have an idea what is to be given just statin, unless and otherwise there is a compelling indication the patient has some issues with regard to pancreas, pancreatitis or other CADs where you need to control the triglyceride and other cholesterol components. Then you can start treatment with 300 to 500 value, but if it is more than 500, definitely you have to treat with fibrates, or the other drug for controlling triglyceride is ezetimibe. So, this is a easy question. The next question, this is also a must know. AV node is supplied, the question you can read, mostly by, the question is very clear. Majority of supply of AV node comes from, that's what is the question. Left circumflex, right coronary, left antedysentery, margin artery. SA node supply is 85% RCA, 15% LCX. For AV node, it is 60% RCA, 40% LCX. So, majority of AV node is mostly supplied by right coronary artery. The answer is right coronary artery. So, left circumflex can also supply AV node. What is the significance of this supply? If there is a right coronary occlusion, you get conduction defects. It could be SA node blocks, it could be AV blocks starting from first degree block, second degree block and higher blocks, complete heart block. So, bradycardia is a complication of right coronary occlusion. In contrast, left main or left antedescending artery will produce hypertension and tachycardia. Tachyarrhythmias are more common. The circumflex can also supply AV node and SA node. This is the EC1, each small square in ECG. So, what we should know is ECG paper speed is 25 millimeter per second. Okay, this is 25, each small box. Each big box is 5 big boxes, 25 millimeters. 25 millimeters. In that, 5 millimeter is one small box. In that, 1 millimeter is there. So, this big box out of the 5 boxes is 1 second by 5. So, 0.2. One big box is 0.2. In that, you have 5 small boxes. So, 0.2 by 5, 0.04. Very important. 0.04 seconds. There is nothing to mug here. 0.04 seconds.